My name is Heather Aspell. I used to be an attorney, and currently I am not working because of my chronic illnesses. I'm also an artist. Since I stopped working, I've been painting and making art sort of related to my experience as a patient and experiences with chronic illness. When I was younger, I started to develop joint pain. I was actually a figure skater at the time and was having some difficulty with my knees particularly. And so at that time, the doctors didn't really know what was wrong with me, and they just kind of said, oh, you're having growing pains. So I lived with joint pain throughout my childhood and continued to think that it was just growing pains, kind of normal stuff, until I got into my late teens when I developed some full body hives and other types of symptoms. So at that point I saw an allergist, and he actually was the first one to suggest that I had some autoimmune conditions going on. And at that point I saw a rheumatologist and was diagnosed kind of generally with either juvenile arthritis or lupus. And at that time they really weren't sure, but luckily I had a great rheumatologist, and so in my teens she started treating me, even though we weren't 100% sure what condition I had. And since then we've kind of realized that what I have is a little bit rarer, and either my doctors currently say I have a crossover between lupus, systemic juvenile idiopathic arthritis, also known as Still's disease, and dermatomyositis. So kind of meet the criteria of all of those and have some kind of crossover disorder. I was lucky enough that my conditions were pretty quiet when I was in law school, so I was able to get through college and law school with just kind of taking a lot of breaks to rest and things like that. But unfortunately, once I started practicing as an attorney, the stress was extremely difficult on my conditions, because autoimmune and autoinflammatory disorders are exacerbated by stress. And so everything I was doing as a litigator was, staying up late, dealing with a lot of really stressful deadlines, and that really made my conditions much more active than they had been in a long time. And so I had to gradually reduce my work hours, which was really frustrating because I loved being an attorney. So I started, I took a 90% caseload, an 80% caseload, 70%, and it kept decreasing. And unfortunately, it got to the point where I couldn't juggle them anymore. There was no way for me to practice and have my health be okay. So my doctors encouraged me to stop working completely once I'd gotten to maybe a 60% caseload, and was still sort of struggling to maintain my health. And so I stopped working approximately 4 years ago. And I still hope that maybe someday my health would be in a state where I can work again in the legal profession, because I did enjoy it. But right now I'm still working to get my health managed, and there's just no way for me to do it while practicing law. The main barrier that I've encountered has probably been that I'm a rare disease patient, and because of that, doctors who haven't taken an opportunity to get to know me individually as a patient have made assumptions that I fit into some generic patient mold, and I've been misdiagnosed because of that. So when I was younger, doctors missed the opportunity to diagnose me and start treatment as young as I could have, which really might have improved my outcomes, because I didn't have a particular blood work marker. And so the barrier of being a rare disease patient has been the main one. When I first became disabled, I wasn't using mobility aids quite so much. So when I would use my handicap parking pass, sometimes people would assume that I wasn't disabled and didn't need it. So I had that period of sort of invisibility where I was sicker than I looked, and so people would assume that I was on disability as a faker, or faking needing the handicap pass. And now that I use the mobility aids, I experience a completely different type of stigma and prejudice, which is, that people maybe feel sorry for me or pity me or think I can do less than I can do. So I think that patients who have invisible illnesses and patients who are visibly disabled because they have mobility aids both kind of experience different kinds of stigmas. Like, I've been in a grocery store and had people kind of like follow me around as I'm using my cane and look at me and make these like really horrified faces, like they're just really upset to see a young person. And then they'll come up to me and they'll be like, it's an injury, right? You know, they really want to believe that that young people cannot get a disability or cannot be as chronically ill as I am. And so I think kind of the stigma that young people don't get sick is the one that I've encountered the most. So when I started using social media, it felt like it was something I was primarily doing for myself. When I had to start using a cane to get around, I found that really emotionally challenging. Partially because of, the way that people would stare at me or the assumptions that they would make about me. And I didn't like the way that felt. So when I would post pictures of myself with my cane, that kind of made me feel better. Like, at first it was just something for myself, and having other people say, hey, you look great, it kind of was reinforced for me that, okay, I can do this. I can go out with my cane. And so I realized that, by doing that, I could help other people too, and that I could even have an impact on, how people view mobility aids and disability and chronic illness itself. So I kind of started to expand. I would post pictures of myself giving my injections or laying out my pills and going to the doctor's offices and things like that to kind of show what I was experiencing. And when I did that, my friends and family, for example, on like Facebook, who were not chronically ill or disabled, would start to comment, oh, I had no idea, or I didn't know that it was like that. And so it really was widening some people's perspectives about what disability and chronic illness looked like. So I just kept doing it, and it's really been empowering for me. And I've talked to so many people online who've told me that, when they see that I'm doing the same things that they're doing, giving injections, using a cane, using a walker, that it makes them feel better about, having to use those things as a younger person as well. My first poor doctor experience was just doctors not getting to know me as an individual. They just looked at blood work and used that alone to dismiss diagnosis that would have helped me get treatment at a younger age. And so, them just kind of chalking it up to growing pains, quote unquote, instead of, actually spending some time talking to me about my symptoms and doing more thorough exams and finding out more about me as an individual really would have made a difference. And currently I'm so lucky. I have great doctors who spend so much time getting to know me, and I can see the difference in care that I get. They really have tailored their treatment plans to me as an individual, and it's because they've gotten to know me as an individual, and my care is much better because of it. I do think a lot of my positive relationships with my doctors has come from me pushing and advocating for it. They have been the kind of doctors who listen, and that makes a difference, because I've certainly advocated for myself and really pushed to have my individual experience heard by doctors and had them not listen. Very recently, I was after one of my IVIG treatments, I had a reaction to the infusion, and my rheumatologist was called, and he sent me to the ER, and because he was concerned that I was having stroke symptoms. And the ER doctor didn't really listen to me, even though I was really pushing for it. So eventually I got out of my bed, walked out to the center, area where all the nurses and doctors were, and said, "Where's my doctor?" And kind of had to put my foot down in order to get him to listen to me. And at that point, I was able to, get what I needed and get discharged and get myself out of there. But it was only because I said something that happened. So unfortunately, a lot of the positive experiences that I've had have come from my own ability to advocate. And I'm very mindful of the fact that so many people can't or don't or won't do that. And so that's why we need to have doctors who are a little bit more willing to listen to patients, because not everyone is an advocate for themselves the way that, is needed in today's healthcare system to get anything done. I think my worst healthcare experience has probably just been being misdiagnosed for years. I have a fractured pelvis right now, and it went 2.5 years undiagnosed. So it's sort of related to the misdiagnosis. But what happened here was I was seeing a urologist. So it was not a doctor who typically deals with the pelvis. But in the course of one of the exams and procedures that he was performing, there was the fracture was seen by the radiologist. So the report noted that there was a pelvic fracture that even then had been there for some time. 2 years later, I was having pain in my right hip. So my rheumatologist ordered an MRI to check it out. Well, the MRI was done at the same place that had done the prior. And when I got the report back, it said, oh, the fracture from 2.5 years ago is still there, and it's, now at this point it hasn't healed, and there's all this other stuff, negative consequences from it having not been treated for 2.5 years. So my jaw just dropped. I hadn't heard anything about it. My rheumatologist hadn't heard anything about it because the physician who had initially done that procedure where it was seen didn't deal with bones or hips. So I think that I'm not really sure what happened, if there was some sort of tunnel vision where he thought, oh, she must already know about this, her rheumatologist must be handling this, or if he just didn't read the report, or if he just didn't communicate it to me. But there was a lapse in communication that occurred, where that physician could have checked in with me and said, hey, are you aware? Has someone told you? Did you know? But that didn't happen. And as a result, my pelvic fracture hasn't healed correctly, and now I'm in a position where I'm not really able to even get surgery for it because of some of the other things I have going on medically. Whereas if it had been noticed at that time, there's a lot of non-surgical options I would have had, or even surgery would have been safer. So that's a pretty terrible experience I had because of physicians kind of being too siloed in their specialties, I think, and not really looking at the patient health as a whole. Another component of it is access to patient records, because I ordinarily get X-ray reports and MRI reports, and I read them carefully, which is how I saw, 2 years later what was going on. But I had never seen the original report because it was done during a procedure. The notes from procedures aren't available to patients at where I get my health care. And I think that's the case at most places. So I do think patients should have access to more records so that patients who want to be vigilant, are going to have the ability to catch these kinds of errors. I've been fairly lucky, and of course, I'm, white, straight, middle class. I sort of don't experience a lot of the barriers that I know other people may because of their, socioeconomic status or race or gender. But, I do find that being young has been the one barrier that I've encountered, and prejudice. My doctors have been fairly good, but the biggest area I've encountered this has been with pain medication. I take pain medication daily for my conditions, and when I would go to pick up pain medication at certain pharmacies, I would have pharmacists really acting like I didn't need it and judging me because of the way that I looked, which is young, and they would make assumptions about whether or not I actually needed it based on my age, instead of just trusting the doctor's prescription. And so I had times where they would tell me that a drug wasn't available even though it was, so that they could avoid dispensing it to someone that they judged as being not needing it, instead of just reading the prescription. So now what I do is I always fill my prescription actually at a hospital pharmacy, because I found that that's been better for me in terms of avoiding the prejudice that I faced at a lot of the commercial pharmacies. And I have occasionally encountered prejudice from physicians because of my age as well, who think that because I'm young, I don't need pain medication. So that's been a frustrating experience for sure. And I think that goes into the entire category of just assuming that young people don't face chronic illness or disability. The thing that's helped me navigate the healthcare system has just been my own advocacy and communication. I've had to push really hard sometimes to get what I needed, but it's been it's been asking my doctors questions, like if I need a certain specialist, it's asking another doctor, to make a referral. As someone who relies on these medications to live and function, I understand why Big Pharma has to operate in some of the ways that it does. But at the same time, when medications become, prohibitively expensive for some patients to have access, that's obviously a huge problem. But I am aware that some of those financial incentives are what allow Big Pharma to develop the kinds of medications that I need as sort of a rare patient with orphan diseases that don't, I don't have FDA approved treatments for some of my conditions. And so I would like to see Big Pharma continue to develop new drugs. And if there's a financial incentive for them to do that, then they're going to be more likely to do it. So I kind of selfishly understand why the drugs may need to cost a lot. But on the other hand, I know that means some people aren't going to have access. So I don't really know what the solution is. So I see Big Pharma as a friend and a foe. And I actually think maybe the issue is more with insurance. And maybe if we make changes in the way that insurance works and covers these drugs, then Big Pharma can still develop them, but more patients can have access to them. And that would sort of, in my view, help the most people get what they need. But it's definitely a complicated relationship that I have with Big Pharma. I really am happy to talk about pain medication, because that is one of the areas that I feel it's really important to advocate for, because I do think that the vast majority of chronic illness patients have faced barriers with respect to pain medication. And I currently am on a number of pain medications that I take round the clock for pain, sort of preventatively, as well as pain medications that I take for breakthrough pain. So I am always on some pain medication and have been for a few years now. I have faced quite a bit of stigma for that. I mentioned there's been times when I've had difficulty getting access to pain medications because of misconceptions that young people don't need them. I've had acquaintances or family members make sort of offhand comments that they don't think I should be taking them or need them, without realizing that pain itself can, how disabling it can be. For me, when I'm on pain medication, I'm more myself. My husband says that that's when he sees my personality come out. I'm able to hold a conversation. When my pain isn't well managed, when I don't take my medication, I find that I can't even follow a TV show. I can't hold a conversation. I can't engage with my friends and family members, and I don't feel like myself. So, the pain medication is something that is a tool that enables me to be myself, to have the best quality of life, to go to doctor's appointments, to go to physical therapy. If I didn't have access to pain medication, I would just be, curled up in a ball, not really able to talk or interact with anybody or even take care of myself. So I do think that it's really important to tell patients stories about how pain medication helps them live and function and be parents or go to work or, live their life more productively and effectively. I think that the number one thing that healthcare providers can do is to just spend more time communicating with their patients, both giving them the information that they need to take care of themselves and implement the treatment plans that the providers have for them, but also to listen to the patients and find out what their individual quality of life goals are. Because I do think that when providers are so stuck on time and they have so little time with the patients, they're not able to really get to know them the way that they need to in order to develop a treatment plan that's specific for that patient's quality of life goals. Because some patients, they want to be able to spend more time with their kids. Other patients want to be able to work. Other patients, like me, I would just be happy to be able to paint a little bit more frequently. And so when doctors talk to their patients, they can find these things out. They can also find out what some barriers might be for patient compliance. I had a great experience recently that I actually think models what should be happening in terms of communication. My endocrinologist was speaking with me about my other health problems and other treatments I was currently undergoing. And I currently am doing twice daily IV treatments that are very just time consuming and draining on me in addition to my ordinary medications. And she ended up prescribing me an entirely different medication that was going to be easier for me to manage just logistically, because she knew I was already dealing with so much for a condition completely unrelated to her specialty. So I think when doctors talk to their patients, they can make treatment decisions that are going to benefit the patient. And so that's really what patient-centered care is all about, is, you know, looking at the whole patient and not just your specialty as a provider. For me, the majority of information I have about my conditions has come from me and interacting actually with other patients with similar conditions. Particularly because I deal with rare diseases. I've encountered a lot of physicians who actually weren't familiar with my conditions at all, and I had to educate them about it. So I'm really mindful of the fact that I am lucky to be able to read a scholarly article and actually understand the medical terminology. Not everyone, is able to do that, and that's really helped me be able to go back to my providers and make suggestions for treatment. And we really, currently my doctors and I really work well together. I go to a teaching hospital, which has improved this somewhat, because the doctors will often have a fellow with them that they're instructing. And so I'll kind of get some education secondhand through that. But when I've seen physicians sort of outside of the teaching setting, they really haven't spent much time educating me about my illness, and that's really had to come from me. And that's also for me been the benefit of social media. When I was first diagnosed with some of my rarer conditions, I found other patients who had them, and they would really pass on a lot of information to me that I could take back to my doctors. So that was kind of another source that I used a lot. Improving the doctor-patient relationship is so important because it makes a difference in the patient outcomes. It makes the patient get better care, and I think it just makes the patient leave a doctor's office feeling better about their condition. I've had doctor's appointments that have left me in tears because the doctor wasn't being mindful of how their words might affect me, and they weren't delivering information in a way that was sensitive. So developing a good relationship with your doctors allows you to just have a better experience. And I think patients who have a better experience are more likely to follow their, with the treatment plans effectively. They're more likely to go back to the doctor. I think about my poor ER experience that I had, and it makes me less likely to want to go to the ER. And there might be an opportunity or an experience where I really need to go, and I'm reluctant to because I had such a poor experience. So it's really important that we ensure that patients feel good when they are done interacting with their healthcare providers, so that they continue to seek treatment when they need it. Young people generally are on social media like Instagram, Facebook, Twitter. And so when I'm posting pictures on these types of sites, I'm giving other people kind of a window into my story, into my experience. And I think that's the best way that we can make change. I know that I've had several acquaintances reach out to me in response to some of my social media postings, and Instagram's probably where I do it the most, because I find that the sort of the visual is really powerful. And they've said to me, I had no idea. I didn't know that this happened to people. I didn't know about, this component of pain medication. They're hearing one thing in the news about pain medication, and then they learn that somebody like me is taking pain medication, and they see, hey, I'm not passed out in a corner. I'm very engaged. And they go, oh, I had no idea. And that helps them, that one person, see things differently. And if we just go person by person by person, if everyone who is chronically ill shared just a little bit about themselves with the people around them, then I think we can gradually change the way that society as a whole looks at these things. And I think stories do so much more than statistics, to kind of help people change their minds. I have friends who, for example, were debating with their family members about insurance issues, and they were throwing statistics and articles at them, and that wasn't changing their parents' minds about the necessity to ensure access to insurance. But when they shared, I had a friend who decided to share some of my Instagram posts with a family member, And her family member actually really responded to that and said, oh, wow, I had no idea that this was how it affected people to have something like the Affordable Care Act repealed. And so for her, it was the story that made the difference. And so that's why social media is really powerful, because it's where we can share our stories with the people around us. I've had mixed experiences with empathy. I have some physicians who are incredibly empathetic, and I'm so appreciative because they, I have a doctor in particular who gives me sort of little pep talks at the end of every visit, and I really appreciate it. And I've had other physicians be really blunt and leave me in tears. And so I think empathy is something that is important. And I think where we begin is probably in medical education. If the medical schools were spending more time, and I think they're beginning to, but the more time that they can spend allowing medical students to actually interact with patients, the more that those medical students are going to learn those skills of empathy and have a chance to practice them. I've heard of programs where medical students are paired with patients and they're able to actually hear about the day-to-day experiences of those patients, see what those patients are dealing with on a daily basis. And the medical students have found those experiences to be really eye-opening because they only see the patients for those few minutes in the office, but to know how much the patient goes through. You give the patient the prescription, but then the patient goes to the pharmacy, and then the patient waits, and then the patient gets the prescription. Then they go home and they read the label and they have to figure it out, how to deal with this new drug. Then they get the side effects and they have to adjust to those. So for the medical students at that level to begin hearing about everything that a patient goes through after they leave the doctor's office by interacting with patients, I think they can better go into practice when they're done with their medical education, prepared to get to know their patients the way that's necessary to show that kind of empathy. Number one thing for healthcare providers is just get to know your patients. Take as much time as you can talking to them, view them as individuals, and I think that is what patient-centered care is all about. That way you can make sure that your treatments are tailored to that patient's particular needs, and that's going to enable you to show the empathy that's needed for that particular patient's situation. The first thing that always comes to mind when I think about what I want to accomplish with my advocacy is just if I could help like one fellow patient not go through some of the negative experiences that I've had, particularly with being misdiagnosed for many years, then I would be just overjoyed, to help one person. I think one of the hardest parts of becoming disabled and having my chronic illness get worse was the isolation that I felt. I spent a long time just home, and that's why I did turn to social media, was for connection. And so I think there are a lot of things that we could do on a kind of a local level to help people have more in-person interaction. And I also think transportation is a huge problem. Like, I have a challenging time getting even to my appointments. So even if there was a space where younger disabled and chronically ill people could get together, I think it would be challenging for them to get there. So I think if the government could continue to provide better services for transportation for disabled people, and to actually advertise those services in a way that younger people are going to see them, that would make a huge difference, because so many people don't even know about the services that are already there because they're being marketed more towards the senior population. So it's just making those, I think we could start by making those services available to younger people and advertising them somehow to younger people. And that would be, sort of a very small step that can make a huge difference. I think beyond that, there's a lot more we could do, but I like to start small. One of the issues that I kind of keep touching on is having the providers have more time with patients. So I'm not really sure what in the system, needs to change in order to make that happen. But I know that it's not the physicians themselves that are creating the limitations on time. I know doctors who want to spend more time with their patients and they can't. So there's clearly something higher up in the system that needs to change to allow physicians to have more time with their patients, and that's going to allow for more patient-centered care. So whether that's hospital administrations or even beyond, insurance companies, again, it kind of keeps going back to insurance in my mind. That's where we need to see changes happen that allow the providers to do these things that actually improve outcomes. It's not just patients and doctors chit-chatting. This is a worthwhile thing to invest in, to spend money on, because we're going to have better patient outcomes. And in the end, hopefully that'll save everybody money. So I think we need to have more collaborative discussions between people who advocate for, maybe the current insurance system we have here in the US and a system like they have in Canada, and say, okay, what are the problems with both systems, and how can we create some kind of new idea that we haven't come up with yet that's going to allow people with serious chronic illness to get access to specialists without long wait times, but also allow people with common ailments to have regular access to preventative health care that is affordable. My overall message to society is that, unfortunately, anyone can become chronically ill or disabled. So these issues about healthcare, they're important. They affect everyone. You may be healthy right now, but unfortunately, you or someone you love may not be that way. And it doesn't matter how old they are. It doesn't matter what their race, gender, ethnicity is. You can be affected by these things. So, don't pass judgment on those that you encounter who may be chronically ill or disabled, and be mindful of the fact that it can affect anyone when you're thinking about issues related to healthcare and insurance in the political area as well. I think the number one thing that other chronically ill patients can do to change the misconceptions is to start sharing their stories. I think that individual stories are the most persuasive thing that we have, and so that if everyone begins to share a little bit about their experience with just one person or with thousands, how through a social media account, then people will begin to get a little bit of a window into what life is like for people like us, and gradually we'll be able to create a shift in what society thinks it means to be disabled or chronically ill. I think that my legal background, combined with my experiences as a patient and in advocacy, could really be a combination that I would enjoy in the future. I'm not really sure what that would look like, but if I did have the ability to work, I really would like to use my legal skills in the healthcare world somehow to make a difference, if I could do that. My cause is just raising awareness about what it's like to be younger with disability and chronic illness, and I do that by sharing pictures on my Instagram account, which is at @Aspell, HASPELL. And I also share on my Twitter account, which is at HCORINI, Corini. And I also have a website where I share some of my artwork related to chronic illness and unrelated to chronic illness, and that's www.heathercoriniaspell.com. So that's Heather, CORINIASPELL.com.